All right, y'all, listen, man. So even though much of life is getting back to a new normal, this COVID-19 pandemic is not over. So we are hearing about variants, people with long-term symptoms and rising cases in some areas, mainly among those who are have not been vaccinated. Dr. M.J. Collier is here with the latest updates and going to answer some of your questions too. Dr. Collier, good morning.
Good morning, Rickey, Smiley, and happy Monday to you. Dr. M.J. Collier, your primary care physician, here to answer your questions about COVID-19 and your healthcare questions about any medical problem. So, Rickey, we have seen increases in the coronavirus incidents now. We've seen over 20,000 cases a day for the past 4 days, so that is now a trend. So we need to be concerned about that. And what people are hearing about are the variants. And so why should you be concerned about them? Well, viruses constantly change through mutation. When a virus has one or more new mutations, it's called a variant of the original virus. Currently, there are several variants of the COVID-19 that cause that disease. These variants including alpha, beta, gamma, delta, and epsilon. These are classified as variants of concern. Now, so you remember originally they were like the UK variant, the South African variant, the Brazilian variant, and then the epsilon variant came from California, and then the delta variant from India. And so they decided to just name these differently because they didn't want to cause problems with those countries, as in like the China virus, that term that was used in a derogatory way by the former president. And they just wanted to basically be more scientific about it because they're not sure whether they originated in them. That just may be where they had the largest number of cases. So we're seeing these variants, and we should be concerned about them because they can cause changes in transmissibility. They can cause more severe disease, i.e. increased hospitalizations or death, significant neutralization of antibodies generated during previous infections or during the vaccination, and reduced effectiveness of treatments, including the antibody therapies that they have been giving people. So there have been lots of questions and concerns about the variants, but let me be clear. The vaccines that we have now, particularly the Moderna vaccine and the Pfizer vaccine, have not shown any resistance to the variants at this time. So we can kind of relax from that.
All right,
okay,
Joe.
Rickey. Now, go ahead.
All right, Joe, let's go to the phones. You're on with Dr. Collier. Good morning.
As the different COVID variants are growing and we're having more people getting sick, what are we doing about the vaccinations? Are we supposed to be getting a booster shot, or, how long does the vaccination last?
Okay, at this time, there's no clinical indication to get a booster shot. The vaccines that are currently prescribed for 2 doses are very effective against the variants at this time, so no need to do that. But both companies, Pfizer and Moderna, are working on boosters that will be specifically targeted to these new variants in addition to the original coronavirus vaccine. As of now, and this is the FDA and the CDC both concur, and Dr. Collier agrees that there should not be any booster vaccines. It's not necessary. The protection given to you by the vaccines now have been shown to be at least good for a year. Originally, they said up to 36 months. I think it may be up to lifetime. So at this point, I'm saying get your vaccine. The biggest problem is in people who have not been vaccinated. But if you're vaccinated and have completed both doses, then you should be protected.
All right, John, Dr. Collier, good morning.
Okay, my question is, I have disc 3 and disc 5 have slipped out in my back, and I've been taking pain pills for a long time. I'm afraid of the back surgery. Advise me on a holistic way to help myself get out of this pain.
Okay, well, good. I highly endorse and recommend chiropractic therapy. That gives a lot of good relief for low back pain. But there's also new technology. There's a laser technology that they use to remove the pressure from disc. It's literally Band-Aid surgery. They insert a needle in your back. It's got a camera in it. They see the bulging disc. They zap it with the laser. It immediately is vaporized and relieves the pressure. You put a Band-Aid on it and you stand up and you're pain-free. So this is absolutely incredible technology. It is not available for everybody, but it depends on the specifics of your case. But if you are eligible, this is not a surgery I would hesitate to get because it shows great relief. They are also implanting electrodes that can block the pain signal coming from the lower back. And I've seen patients go from 10 plus pain for years to zero pain after that procedure. So multiple therapies available. Consult with your local or orthopedic and back specialist and find out what options are available to you, but you don't have to live with that pain.
All right, Joe, Dr. Collier, good morning.
Hi, good morning.
So I'm a breastfeeding person, and I've been trying to keep up with research, but I haven't seen much on breastfeeding people. Is there anything that we should know about getting the vaccine and how it could possibly affect us or our child?
Well, if you're actively breastfeeding, they're recommending that you be cautious about getting the vaccines, but there's no direct contraindication, and it may pass antibodies on to the baby that would give the baby protection as well. So I would consult with my OBGYN or my pediatrician specifically in your area about variants that are there. And, again, they're looking at vaccines down to age 2 right now, but not in babies that would be of breastfeeding age.
All right, Joe, Dr. Collier, good morning.
My question is, with the COVID vaccination, my son's oncologist said he shouldn't take the vaccine, but our primary care doctor said he should. What do he think?
Well, if your son is under the care of an oncologist, that means he has cancer. And so it depends on what type of cancer and what type of therapy he's currently under. There's a case right now of a woman who's immune compromised who actually had 2 different variants of the coronavirus at the same time. That's the first case that's been recorded of that. And but she did respond well to treatment. So in this case, it just depends on what your son has been actually doing. But if he is immune compromised, he might have to get a booster. He might have to get 3 doses of a vaccine to give him protection, and that's what's being recommended in that case.
All right, Joe, real quick, you're over Dr. Collier. Good morning.
I want to ask, what can I do to help with my edema? Because I work 12 to 16-hour shifts, and my compression socks are not working.
Okay, one, diuretic therapy helps tremendously, but wearing compression socks is one of the primary therapies because it keeps the pressure down. Oftentimes, physical therapists will offer some treatments that help edema tremendously, but it depends on whether it's edema from just standing on your feet or whether it's lymphedema, the disease state, which is very difficult to treat. So you have to be conscientious about your sodium intake, the amount of water that you're drinking. Oftentimes, people with edema will limit their water intake, and they need to drink more water so that they're diuresing and removing that fluid. If you're working, elevate your feet every 2 hours for a few minutes to allow that fluid to drain, and keep those compression socks over the calf compression socks. There are lots of them available over the counter now. You don't have to get prescriptions for them, and wear them every day, all day, and even sleep in them, and elevate your feet at night. Put a pillow under your knees so that your knees are bent at about 15 degrees. That'll allow the fluid to drain, and you should wake up with small feet, no fat ankles.
So Dr. Collier, you suggest that for barbers and beauticians and security guards wear compression socks?
Absolutely. Anybody that's standing on their feet, but I wear them every day myself because if you close the space, there's no space for that fluid to collect.
Yeah.
So you're going to have good things. And there again, I buy them, like 20 pairs at a time. They are very good, and they keep that fluid from collecting because once you start to dilate, it's a problem.
Do they have Nike low-cut compression socks? Never mind. You can answer that when you come back, Dr. Collier. We really appreciate you, the one and only Dr. M.J. Collier. It is 25.
These are the opinions of Dr. M.J. Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show production crew or cast. Listen to around the country and around the world via the internet. Tune in to the Rickey Smiley Morning Show. Your primary care doctor, Dr. M.J. Collier. Reach me on all social media at ASK Dr. MJ. Go to my website, lifewilldrop.com.
Man, hang on. Go on, man.
To get sexy you still got time to get sexy for the summer.